Hi, welcome everyone. Happy Friday. Welcome to the Partnership with Drug Free New Hampshire's National Prevention Week Facebook Live series. We have invited prevention professionals from a variety of roles across the state to share their prevention story, their expertise, and their experience, strengthening community, building resilience, and creating hope, which is the theme of National Prevention Week this year. So I'm really excited to have Tracy Fowler here with us today. Tracy has been in prevention in New Hampshire for decades, right? Can I say decades, Tracy?
I mean, I'm only 25, so you could. No, honestly, I think because I really began 20 years ago, in the year 2000, so 22 years ago.
Right, so a couple decades. All right, I wasn't
a couple decades. You were not exaggerating. Yes, exactly.
Great. And currently, she's a senior program officer at the New Hampshire Charitable Foundation. And today's topic is prevention is everywhere, highlighting the efforts across settings and communities. And Tracy was just such a natural guest to invite because the Charitable Foundation has a huge investment in our, prevention communities, and so she has an acute knowledge of what's going on in the state. So welcome. This
Thank
week,
you.
Today's Friday. We've been doing this every day. We've talked to Celeste Clark from Raymond Coalition for Youth, which is a drug-free community coalition. We've talked to Rebecca Lerner, who's a student assistance program counselor at Nashua North High School. Hands-on direct service. As well as community level universal strategies. Jennifer Sabin, the New Hampshire Suicide Prevention Coordinator from DHHS. So really looking at that state level and that strategy and strategic planning. And then Jody Longiletti from the Dover Mental Health Alliance, looking at how suicide prevention and how everyone plays a role, right? Then we talked yesterday with Marissa Carlson from the New Hampshire Teen Institute, and more pertinent for yesterday's conversation, the New Hampshire Prevention Certification Board, really looking at that talent pipeline and how to enhance prevention professionals in the state. And so today, everywhere, right? So we really looked at how prevention is everywhere. And each one of those speakers talked about all the different levels that you can see it at. And I just want to hear your take on that. How do you see prevention being everywhere?
Yeah, and what an amazing lineup of guests. Oh my goodness. And yes, I mean, it really is everywhere. And I think for those of us who have been in the work and understand the work, we see it so often. And it's great to have opportunities like this to be able to highlight pieces that other folks may not think of as prevention or may not see as prevention. One of the pieces that I would be remiss if I didn't mention policy and policy advocacy, because as someone who, I'm a social worker by training, and I remember even in kind of the early days of working in schools, for example, and seeing how the individual practices were shaped by what we could or couldn't do because of policies at the school level, at the state level, at the federal level sometimes, so I think that what we absolutely in New Hampshire are so we are really good at coordinating around policy and coordinating around advocacy, because we are so grateful to have organizations like New Futures and NAMI New Hampshire. Those two come to mind in particular because of our topic. And the Charitable Foundation, we are very grateful to be able to support that work, because it's such a critical piece of the puzzle that without being able to understand how the individual practice is connected to the big policy picture, I think you could really spin your wheels sort of at the practice level, saying, man, why can't we do X, Y, or Z? Or how come we're not allowed to to move in this direction, or, and it just, lo and behold, it could be because of policy barrier. So, one example of recently, which I think folks in the prevention community was such a win that we really needed, I think, around a couple of issues. One was around the Youth Risk Behavior Survey, which a lot of folks in the prevention field may know. And that is over this past, I would say, decade, we've seen really such growth in being able to collect and use data to inform practice. The Youth Risk Behavior Survey collects data on so many different risk and protective factors for middle and high school kids. And we were at risk of losing it in our state. And that would have been a huge hit to the field. And so again, it's just, it was just an example of, being able to make sure that folks at the community level were aware that policy change was brewing, and how could they get involved, and how could they show up and share their stories, and how could they make sure that the deciders were able to understand how it was used on the ground and in school and community. So that was a huge piece of the puzzle. And I would just say, if folks aren't familiar with New Futures and they aren't familiar with NAMI New Hampshire and the work of what advocacy means, it really is not intimidating to look at their websites, check out the bills that they're following, join an advocacy training, ask some questions, just start to tiptoe towards that direction of seeing how those policies may be impacting the work that you're planning to do or are doing. So, yeah.
That's great. Yeah, that was such on so many levels. I thought that was a really amazing collaboration and connection on the YRBS, and also other policies around the
marijuana,
cannabis commercialization, and that prevention community really got together. I do want to just bring attention. Thank you, Stan, for starting this off. But if there are any other listeners, please let us know that you're here, and say hi and where you're tuning in from in the chat. That would be great. And thanks for being here. So that's Stan. I don't know if you saw that, but Stan.
I saw that. Yay. Hi, Stan.
But so you said, that to make sure to do, how do we have an impact on policy? How did this happen? What did that look like? And I know you mentioned New Futures and NAMI and their advocacy training, but I think advocacy training sounds really big to me. Could you?
That's a great question.
What does it look like on the ground? Yep. What made such an impact?
That's a really great question. And I think so, one of the pieces that I think is important is to look for the people in the community, how both NAMI and New Futures work is really by working with organizations, kind of like almost organizational hubs, so providers out in the community, coalition leaders, public health networks, different service providers, and using those organizations and those kind of community hubs and community point people to get the word out to parents, kids, people with lived experience, people who can speak their story. And it is about sharing stories of them, stories of, the experience of what it's like to have dealt with the system from a parent perspective, of having worked through addiction as an individual, making sure that those stories come forward, the challenges, the barriers, the successes, and bringing all of those stories forward. And both New Futures and NAMI do a wonderful job of helping those individuals feel safe and supported in sharing their story and learning how to talk about that, talk about those experiences. And I think that for organizations and for listeners who, may be intimidated, it really could be as simple as just, picking up the phone and calling the folks at NAMI, at New Futures, and just starting a conversation saying, hey, I'm a service provider, please, give me more information about how I could be involved. And it may be your voice as a service provider, but it also might be the voices of folks that you're connected to, and thinking through ways that you can help be a liaison to getting some of those individual stories back up to the people that are making the decisions on policy. And, I think it really is important, those individual stories, having kids show up to the State House, having parents show up to talk about, the experiences with the system. It helps to reduce stigma. It helps to make these issues human. It with a YRBS hearing was a great example of just, it was hours. I think it was a few hours. I think that committee was hearing testimony, and it was really about listening to, okay, how exactly are parents informed? How exactly do schools, do community partners use this data? And they really were asking these questions because they didn't know. They're not doing this work every day. So it's just about translating, it's kind of about translating the work, but it's also about, shedding light on elements of, the issues, addiction, mental illness, suicide, that people who aren't doing the work every day, they may not know. They just, they haven't, it's not their day to day. So yeah, it's definitely not as intimidating as it may sound.
Right. I mean, that sounds, that's education to me, right? That's telling your story, right? It's often what we do on a Saturday morning walk with our friend, right? We talk about, how we're having a difficulty with the system, or how, how a policy is preventing something that we know would be really helpful in our work or our families or our communities to happen. So we do it, right? We share our stories, and that's even advocacy, right? Sharing it with other people, even our friends, but making that, getting that up the chain to the decision makers is so important. And I've been to those trainings that at NAMI and New Futures, and they're wonderful. And then as soon as you join their mailing list, you get informed. There are really helpful guides of, who to contact. Sometimes I'm like, wait, who is my representative? Like, who do I need to
it's true.
And the website can be cumbersome to figure that out. But they give you the link, so it's a really,
totally, they'll help. It's a very warm environment. It's supportive. They're not tossing you to the wolves. Like, all right, go figure it out. Good luck at the State House. It's very supportive. And I think the advocacy community across the board is very supportive, and so it is a chapter of the work that is worth exploring if folks haven't tiptoed in that direction. It's great to just, to ask some questions and start to check the website out, get on a mailing list, just like you said. Yeah. And
it can be verbal and written, right? It doesn't have to be for if somebody's not comfortable talking in front of other people, right? Like there are a lot of access points. So. Well,
absolutely. And absolutely.
And I think that's a piece that, I appreciate you highlighting that, because we've looked at this week quite a bit of, direct service, or, some really, I don't want to say obvious, but, when you hear it, you're like, right. But advocacy, I think, is a piece that doesn't necessarily, people don't think about when they think about being a big part of preventing, unwanted outcomes, right?
Any chronic substance use. Exactly. You can't improve a system unless you work on policy. It's sort of like the nature of the beast.
Right.
It's the nature of the beast.
Even in your family system, right? Like you have to have some rules and like policies to make
a good point.
Kind of work smoothly. So I also wanted to take an opportunity, because I know that you work with innovative programs and sort of up and coming and let's see, programs and processes that are going to address some of these gaps in the system. And I wanted to give an opportunity to highlight a few of those, if you wanted to.
That would be excellent. And one of the efforts I want to make sure folks are aware of is, which it sort of lives under something called the Children's System of Care. And it is called Creating Connections, New Hampshire. And I think you guys may be able to put the link in the chat. And Creating Connections it's actually not a new initiative to the state, in that we've done this in previous years, but a while back. But it's implementing a youth kind of treatment for co-occurring disorders, substance use and mental health. And it is implementing an evidence-based practice around treatment and recovery. The piece that I wanted to highlight, and so I want to just hover quickly on the Creating Connections. Right now, it's federally funded, and it is for youth ages 12 to 25. It is being implemented by the New Hampshire Bureau of Children's Behavioral Health. They're a wonderful, wonderful group of individuals. They're under New Hampshire DHHS. And there are a few sites across the state where Creating Connections, this kind of 7 challenges model, evidence-based model, is happening. So there's Portsmouth, there's Newton, sort of Dover area, Nashua, Stratford County, Lakes Region, Laconia, Plymouth area, and then Manchester. And I believe that there are more. I believe their UNH Institute on Disability is sort of the hub and the grantee who's helping to provide support to get this model out into the community. And because it's an evidence-based model, of course, like there's fidelity and there's all of that. And the IOD, UNH's Institute on Disability, they're amazing at implementation and implementation science. And they're really good at making sure that, you've got kind of the roadmap of how to get to this outcome, and making sure that programs and organizations have the support to follow that map. But the piece I wanted to highlight out of that model is something that we haven't really had in the state, which, I think is building momentum across the country as well, but it's really youth peer-to-peer recovery support and alternative peer groups. I think what it's, the sort of like the name is, you can call it under the umbrella of an alternative peer group. And it's about connecting kids to each other. And again, sharing personal experiences and reducing stigma and creating a safe space and talking about, people's experiences and young people's experiences with substance use, with family substance use, with mental health, mental illness, things that they're struggling with, to walk into a space and be able to share that safely, judgment-free, and in a supportive environment, I think is absolutely what's necessary right now. And the model so far is been extremely successful, as you can imagine. And it's growing, there's a lot of momentum building, and it's growing across the state. So, I think that's just one example of how recovery and prevention, I think for folks in the field, we know the continuum of care is really, it's important. All of the elements of the continuum are important. Recovery and prevention share so many similarities in, they're almost mirror images, in a lot of ways. And recovery is prevention, and prevention can be recovery. And they're just excellent. The two sides of one coin. And I think that this is a great example with these youth models, in that it really is, the layers of prevention. And, it is maybe more of an indicated population who engage. And then, as they step into that space, I've heard stories of, they're not yet ready to go into, get into treatment. They're just, going in to kind of have a conversation. And after some time being with this group, they're like, you know what, I am ready. I'm ready to try to deal with this. I'm ready to work on this.
Right.
It sort of helps change that direction. It changes a path, and that's prevention.
Yeah.
And so I think that's just a model that I know is, I know that they're looking to get some more sites on board. I think they're going to have an RFP process out soon. So I think it's just, again, if you're not familiar with it, ask some questions, reach out to the UNH IOD.
That just was put in the chat as well.
Oh, good. Okay.
That you bring that up, Tracy, because our when Rebecca was on the SAP, that's when we said, is there, somebody asked in the chat, is there anything that you don't have that you would like, and this is what she said. She said treatment options for young people, and help getting the path in a non-judgmental way, where they can see where they're at, and move towards wanting to engage in reducing or abstaining from their substance use. So
absolutely. It is about, so much of prevention. I think the folks on the call probably are all very good at connecting dots, because that's like a big part of prevention and public health, is just like, we're like the little dot connectors, and this is a great example of connecting dots between the children's system of care work, which is largely living in the children's mental health space, and the substance use prevention, the substance misuse prevention space. And for whatever reason, because things get siloed, in the state and in every, in other states too. It's not just New Hampshire that things get siloed in, but those two worlds don't really often overlap and communicate. And so there could be an SAP at a school, and there could also be, this alternative peer group model happening. And do the two connect? I have no clue. It's a great idea to, if you're in a community where one of those pilots is happening, to make sure and ask, like, who else is involved and who else should be involved, and who should come around this table to think about, are we capturing, are we leveraging all of the possible resources here to really make this effective and reach who it needs to reach. And it's not anyone's fault that, there's just a lot of great work happening, and there's a lot of things moving, and it's just, the role of the dot connectors to try to bring it together.
Absolutely. And that's why these are wonderful, because I'm sure there are either people listening now or who are going to listen that had no idea about these alternative peer groups. And so that's great.
Yeah.
Thank you for bringing that up. We are at time. Unfortunately, we've been trying to keep these to 15, 20 minutes. But I really appreciate all that you've highlighted, the fact, some wonderful, I think for many people, not thinking about advocacy as a prevention strategy is probably the norm. So bringing that up and highlighting that in all the different levels, and then bringing this really great connection between in this children's system of care and alternative peer groups. So I appreciate that. If there's anyone still on and you have a question, we could answer it. If there's anyone that gets it in real quick. But Julianne says thank you, and we all say thank you here at the partnership for having you. And we hope if anyone has any questions for Tracy, she's at the Charitable Foundation, or you can reach out to us here at the Partnership for Drug Free New Hampshire, and we'll try to answer it. So thanks, everyone, and enjoy your day, and have a beautiful weekend, and enjoy the sun.
Oh my gosh, yeah, the heat wave.